Good afternoon. Thank you to everyone listening again today and taking the time to stay updated on the COVID-19. As of 2 p.m. today, there have been 1,031 positive cases of COVID-19 in Missouri, including 13 deaths. We know this is not easy, and it may seem like there is no end in sight, but I assure you we will get through this. We are working every day to make sure that happens. Yesterday, I spent the day communicating with medical experts, mayors, faith leaders, emergency personnel, and other local officials across the state to make sure our communities are prepared for whatever comes next. PPE continues to be one of the biggest concerns, and we are addressing this each and every day. As I said Saturday, we have approved the purchase of tens of millions of dollars worth of PPE. SEMA has purchased over 6 million surgical masks, over 5 million gloves, over 5 million N95 masks, and over 900,000 face shields, as well as hundreds of thousands of other supplies. As PPE continues to arrive, SEMA is working rapidly to get these shipments out to the hospitals, to law enforcement, fire services, and first responders across the state. Our health professionals must be able to treat Missourians during this critical time. In addition to obtaining more PPE, we also are working with the Department of Commerce and Insurance to remove regulatory barriers that may interfere with their ability to operate at maximum efficiency. To allow professionals from other states who wish to help and provide care in Missouri, I have approved a waiver granting full reciprocity for physicians and surgeons. We must also realize that physicians and nurses on the front lines of this outbreak may be unable to treat patients due to quarantine. To help with this, we have also temporarily waived a regulation requiring that a collaborating physician and advanced practice nurse be within 75 miles of each other. This will allow our health professionals to continue providing care using telehealth, which will help reduce the spread of the virus. Health insurers have also stepped up in many ways to help, and we greatly appreciate their efforts to help meet the needs of Missourians during this challenging time. DCI Director Lindley Myers is here today to give us an update. Director?
Thank you, Governor Parson, and I appreciate this opportunity. I especially want to extend my deep appreciation to all of the dedicated health care professionals who are working diligently on the front lines of this public health crisis to treat patients and help contain the spread of the COVID-19 virus. We know that you're doing everything that you can, and we stand in support of your efforts. But we want and need to do more to assist you in this work in order to increase access to health care and to extend the vital help to all of our healthcare professionals. The Department of Commerce and Insurance requested and received approval of a waiver that grants full reciprocity for physicians and surgeons who wish to assist Missourians during this COVID-19 crisis. During this state of emergency, physicians and surgeons who are licensed in another state can provide care to all of our citizens in person or using telehealth options, as long as they are actively licensed in another state and their license hasn't been disciplined. The purpose of this reciprocity waiver is to allow healthcare professionals to provide care of significant need during this public health crisis without having the barrier of government licensure issues to hamper their ability to practice in Missouri. By having this access granted to additional providers, we increase our ability to meet the needs of Missouri patients who are being tested and treated for COVID-19. Nurses are not included in the reciprocity waiver. Missouri is a member of the Nurses Licensure Compact. This compact allows for RNs and LPNs to practice in person or via telehealth in both their home state as well as all 32 NLC states with one multi-state licensure. This allows nurses who hold a multi-state license to provide care across state lines. Also, effective immediately, the governor has temporarily waived the regulation requiring that a collaborating physician and an advanced practicing registered nurse be within 75 miles of each other. This waiver was requested by the Missouri Board of Nursing and the Missouri Board for the Healing Arts, who worked in close collaboration to increase this workforce mobility for our physicians and advanced practice registered nurses. This waiver expands the ability of our healthcare professionals to directly serve the needs of our citizens during this COVID-19 outbreak and reduces travel on both patients and the providers, which helps reduce the spread of the virus. I would like to extend a special thank you to the Missouri State Board of Registration for the Healing Arts, the Missouri State Medical Association, the Missouri Association of Osteopathic Physicians and Surgeons, the Missouri Academy of Family Physicians, the Missouri Board of Nursing, the Missouri Nurses Association, the Missouri Hospital Association, and the Association of Missouri Nurse Practitioners. Your swift work and willingness to collaborate during this time of great need will help us provide more and greater access to care and greater mobility for our healthcare professionals who are working on the front lines in this fight against COVID-19. Thank you so much for your efforts.
Clora, thank you very much for what you're doing. I appreciate that very much. The Department of Social Services has also confirmed taking action and ensuring Missourians have the support they need to stay healthy. Acting Director Tidwell is here today to give another update. Jennifer?
Thank you, Governor Parson. Good afternoon. I want to share with you what the Department of Social Services is doing to help Missourians during this time. I want to start by providing an update on additional SNAP benefits, so food stamp benefits that were authorized in the Families First Coronavirus Response Act that was signed into law nearly 2 weeks ago. The first benefit allows all current SNAP households to receive the maximum allotment for the months of March and April. I'm pleased to announce that the March benefits will start to be available to SNAP households today, March 30th, and by the end of this week, all SNAP households will have access to their March benefit. The additional April benefit will be part of the amount that is available on each SNAP household's card, whatever day of the month that they typically receive their benefit. This will provide additional food benefits for 310 Missouri households, or 660,000 Missourians. To give you an idea of what this benefit means to a household, the maximum allowable benefit for a household of 3 is $509 monthly, and a household of 4 is $646 monthly. The other benefit that we are also implementing is a benefit that's available to families who are eligible for free or reduced price lunches. This is a benefit that will be eligible to those families during the months of March, April, and May when schools are closed. This benefit has the opportunity to reach 420,000 Missouri children. Currently, we have submitted a plan to the United States Department of Agriculture to implement this benefit, and we're awaiting approval. We are also working with the Department of Elementary and Secondary Education to ensure that we have the list of families that we need to reach out to. We estimate that we know about half of these children through the current SNAP households. The other families, we will be working with stakeholders and other government agencies to provide outreach when we have additional information. In addition to the 2 additional SNAP benefits available through the Act, we have also sought and received 2 waivers from the United States Department of Agriculture to ensure Missourians continue to receive benefits during this time and to simplify the eligibility process. First, I'm pleased to announce that we are able to extend certification periods. So that means the timeframes that families have to engage with our department to renew benefits by 6 months during the months of March, April, and May. What this means to a Missouri family is that if they were supposed to engage with us during March to renew benefits, they don't have to contact us and work with us until September. Additionally, we received approval late last week that we are able to suspend applicant interviews as a condition of eligibility in March and April. What that means is if we have a family or a household who has applied for SNAP benefits and we have all the information we need to make them eligible, we do not have to go through an interview process or reach out to that family to ask additional questions. With the exception of the additional SNAP benefits and waivers discussed today, all SNAP eligibility guidelines remain in place. If we do have families that aren't eligible for SNAP, we are working on how we can assist those families by developing a list of food resources by community that should be available on our website later this week. Our website is mydss.mo.gov. We are also working with food banks, food pantries, and the Food Bank Association to make sure that we are providing the support that they need to deliver food to communities. We also know during this time that child care remains a need for many Missourians in essential employment. I want to remind Missourians that the Department of Social Services does administer a child care assistance benefit for eligible families. Additionally, I want to remind families who are currently eligible for that benefit and receiving that benefit that we are available to help them make provider changes if their current provider is no longer able to take care of their children, or to change the hours that they have access to the benefit if their work schedule has changed. We also want to make sure that during this time we are supporting child care facilities caring for Missouri's children. That's why I'm pleased to announce that effective with March services, we will be making a temporary payment through our Department of Social Services child care subsidy payments to ensure that providers receive no less amount for March services or services through the emergency timeframe than what they received as an average payment for December, January, and February. We are asking providers to work with us to ensure that they pass on some of this funding to workers who may be displaced from the child care industry at this point so that we are able to maintain child care services for families as we move back into a normal course of business. On average, we pay 2,400 child care providers monthly. Child care providers can find out more information about this benefit at dss.mo.gov under our COVID-19 response updates. Finally, in the Medicaid program, we are pleased to announce that effective last week, we had made available to uninsured Missouri citizens testing positive for COVID-19 with monthly incomes below $904 for an individual or $1,222 for a couple, and assets below $4,000 for an individual and $8,000 for a couple eligible for Medicaid services. I also want to remind Missourians that during this time, we are suspending all Medicaid reviews with the exception of citizens moving out of state. We also want to continue to thank our providers and support our providers during this time. That's why I'm pleased to announce that on March 23rd, Missouri received approval of an 1135B waiver from the Centers for Medicare and Medicaid. This waiver grants a number of exceptions, including extended use of telehealth and a temporary change in the early refill policy, electronic prescribing, and also impacts signature requirements. Again, this information is available at our department's website under the COVID-19 response updates. Also, I'm pleased to announce that the MoHealthNet division has increased communication with providers by providing an email address for providers to ask billing questions around COVID-19, which is mhd.covid-19@dss.mo.gov. And MoHealthNet continues to provide extensive outreach to providers. Information or questions or eligibility access is available 24 hours a day, 7 days a week on SNAP, childcare, and Medicaid at mydss.mo.gov or through a toll-free number, 855-FSD-INFO. Our toll-free number is answered Monday through Friday, 6 a.m. to 6:30, Saturday, 8 a.m. to 5 p.m., and Sunday, 10 a.m. to 3 p.m. I also want to mention that we continue to be open 24 hours, 7 days a week to accept hotline calls if there are concerns about child abuse and neglect. That number is 1-800-392-3738. Finally, I want to take an opportunity to thank the DSS team who is working 24 hours, 7 days a week to support Missourians. There are team members ensuring child safety, team members and provider partners caring for youth and residential facilities, team members on the phone 7 days a week assisting clients and processing applications for services. And we will continue to be there to support Missourians. Thank you.
Jennifer, thank you very much. Kelly, I'll turn it over to you for a few questions now.
Okay, we have several here today, Governor, for you, and then I've got a couple for Dr. Williams. The first one, Governor, is from Jeff Bernthal, Nexstar. When do you anticipate the pandemic will reach its peak in Missouri, and what factors could change when the peak hits?
Well, I think there's different models out there that say when that peak's going to get. I think we're all looking somewhere around the middle of the April for a turning point to give a really in-depth evaluation. But again, I want to make sure everybody understands. I think we're still 60, 90 days away from getting through this virus, and that's kind of a best-case scenario. But I do look somewhere between the middle of April. I think we're going to be able to get some new information, some new statistics. I hope so, to be able to do that, and hope we start turning the corner. But the reality of it is I think we got to all realize that this is going to be a long term, and I don't want to give false hope to anybody. Nobody really knows when this virus is going to peak and when it's not. A lot of guesstimates are out there, but I do think when you look at some of the national experts, some of the experts we have in the state, I think April will be a little bit of a telltale month.
All right, this question is from Kurt Erickson, the St. Louis Post-Dispatch. Some Missouri state parks saw a huge number of visitors this weekend. Have you considered closing any or all of the parks in order to ensure people practice safe social distancing?
Yeah, we're a little disappointing there of what happened over the weekend at some of the state parks. We're trying to leave facilities like that open for the general public, but unfortunately people didn't abide by the rules we're talking about the social distancing. So we're going to make that decision. We're in discussions about that right now, whether we close those parks down or not. But the one thing I think is so important with that question is you have to do what the orders say. You have to stay the 10-person group, less than 10 people in a group, 6 feet distances that you have, and the social distancing we got to have. But you got to continue to do that, and everyone is responsible for that. Everyone.
Okay. This question, Governor, is from Curtis Hancock. He is with ABC 17, Fox 22. Will Missouri shut down interstate travel such as other states have done?
We do not plan on shutting interstate travel right now. One of the things we're looking at who does come into the state from different hot spots around the United States. But every day, I want to stress, we look at everything, the data that we have, the information we have to make those decisions. But right now, we're not planning on shutting any highways down in the state of Missouri.
All right, this question is from Ryan Hennessey from St. Joseph News Press in St. Joseph, Missouri. What is the state of Missouri's plan for homeless individuals that contract COVID-19?
Yeah, I think one of the things, I was on a phone call yesterday with the mayors. They're deeply concerned about that. And I think right now we're looking at alternatives how we might be able to help with that from different parts around the state, whether that's a housing area where that may be in a warehouse setting or where they may be an open floor setting. But we're looking for alternatives, what we do with that. But again, those bring their challenges itself when you start doing that. But we're working on it every day. We talked to mayors briefly. They told me their concerns yesterday about that, and we're going to be reaching out to them to see how we might be able to help with that.
Okay, this question is from Alexis from KMOV4. She'd like to know, why are the news conferences not open to the media?
Well, because we're abiding by the rules of the state, by the order of the state. You can't have any more than 10 people in a room together, plus the 6 feet distancing part of it. Look, what we're trying to do on the media side of it, we're trying to go live here every day to try to make sure everybody has an opportunity to see this. The other thing was we're trying to answer as many questions as we can when they come in today. and try to handle it just as normally we would any other public press briefing that we're doing. And we're trying to do that every day. But, you know, everybody's finding alternative ways to get things done. And the same thing doesn't make any difference whether you're in the governor's office or whether you go to church. You know, you just got to find alternatives way to do that. So we're going to continue to look at that. But right now we feel like we're trying to answer several questions every day to be able to let the people back home know what we're doing.
All right, this question is from Aviva from KCUR. And she'd like to know who you have been consulting with in regards to the stay-at-home order and if you've changed your mind since then.
Look, the stay-at-home order, we talk to people daily about that. We talk to experts over the weekend, some of the medical experts. You know, everybody has a different version of what we should do on a stay-at-home order for the state of Missouri. Again, we have to evaluate the whole state, and we have to look at it county per county and what is occurring in those counties. The one thing I focus on every day is real data. How many people do we have in the hospitals? How many people have tested positive? And where does that model, where do those things lead us to in the future? Those decisions are not easy to make every day. And again, no matter whatever your order is, or no matter what the exceptions are, it's going to come down to people abiding by the orders and staying in the groups of less than 10 and the social distancing. That's what it's really going to come down to, and it's going to come down to individual responsibilities.
All right, this question is from Caitlin with the Kansas City Star. About 2 weeks ago, Kansas Governor Laura Kelly issued an executive order temporarily suspending evictions until May 1st. Since then, housing advocacy groups like KC Tenants have called on you to enact the same type of situation for the evictions. What do you have to say about that, or what is your plan? You
know, again, I think we talk about those things daily, how we might approach something like that if that need comes about. But, you know, look, I think you got to be careful just reacting to what people might think or what people say. You have to evaluate each situation. What is the effect of that? And what is happening in that category? Are people getting evicted now because of the COVID-19? I don't think any of us want that to happen. But you got to evaluate every one of those situations differently. And we do that. We do that every day. But again, it's difficult to make a blanket policy for the entire state of Missouri.
Okay, I have one last question for you, Governor, from Rudy Keller, Columbia Tribune. I want to know today if the governor will extend his social distancing directive currently set to expire April the 6th.
Yeah, we're definitely in the process of doing that. We know we're going to expand that. You know, I think it's just a matter of where we move that time frame to. Again, you know, I'm thinking we're at least 30, 60 days away from any kind of lifting any orders. So, but we're evaluating that daily, and we'll make a decision on that by the end of the week because the other order expires at the end of this week.
Okay, I have two questions now for Dr. Williams. Dr. Williams, this is from Dick Aldrich. He would like to know about the ventilators. How is our ventilator supply in the state, and how many currently are in use?
Well, we keep up with that daily from the Missouri Hospital Association. We don't give out the exact numbers, but we have adequate ventilatory and ECMO capabilities at this time. We also, as you know, have 123, I believe it is, ventilators that the state has and 220 on order. But as the governor said, that's something we watch daily. At this time, throughout the state, we have excellent capacity. We do pay special attention to our areas, our metro areas, the St. Louis area especially, and Springfield. We can't say enough about our partners working together, both in Springfield and St. Louis. All the different hospital systems have worked very closely together, and we're greatly appreciative of that and think that's one of the main reasons that we think that we will stay ahead of this.
Okay, and this, again, this one is from Alexis from KMOV4. It's kind of a two-part question, but is the state tracking numbers of recovered patients, and do you know how many are also been hospitalized?
Yeah, thank you for that question. We get that data as well for COVID-19 patients. It reflects our national trends, which, as you know, of 100 patients, about 81 will have mild disease and will not go in the hospital. And we don't wish that for them because they'll have a fever and not feel good, but at least they don't get more ill. After that 81, you'll have about 10 to 12, which is reflected in Missouri, who may need some hospitalization. And our numbers reflect that. They may need some oxygen. They may be in the hospital for a couple of days. And then we have about 6 to 8 out of that 100 who will end up on ventilators and ICU. We met yesterday, as the governor said, with the infectious disease and intensivist. And so our numbers are reflecting that. Again, on National Doctors Day, which it is, we are incredibly appreciative to the physicians and all of the healthcare providers who take care of those patients and enable them to get out of the hospital either fairly quickly if they just need oxygen, and then for the more prolonged ones, which can be up to 10 to 12 days, especially on this day, we're incredibly thankful for all our physicians who work hard every day and with nurses to make that happen.
Okay.
Let me just make a comment on what Dr. Williams was talking on the testing that we're talking about. Every day we're trying to do more and more testing in the state of Missouri. And frankly, we want to do that, as many as we possibly can. And by doing that, those numbers go up. But that's also a good thing when those numbers go up because you're identifying the people who need to be treated or how to identify those people. A lot of other states are not testing as much as we are. But so when we look into the numbers sometimes, you have to understand at the end of the day, we want to identify the people that have COVID-19 so we can address that issue. And I think that's important to understand when we read numbers sometimes when they come out to you. And I think hopefully we're going to increase that testing capability every day. And when you look where we started a week or two ago, you know, you're doing 400 or 500 a day, and now we're doing over 2,000. And that number will increase by the private sector coming on. So to have that knowledge is also good to have the data to be able to prepare for the COVID-19 on that. Let me just say, I just want to thank everybody again who's staying home and following social distancing orders. This is the only way we will stop the spread of COVID-19, and we greatly appreciate the Missourians who are doing what they've been asked to do. As I've said many times, this is not just about you, it's not about any individual, it's about all of us. We will conquer COVID-19, but it's going to take all of us working together and obeying social distance orders. For yourself, your loved ones, and your fellow Missourians, please stay at home. Thank you, and God bless.